Hello, I'm Dr. Rohini. So, today I'm going to discuss a very important and interesting topic, that is PGT, that is prenatal genetic testing. So, this procedure is basically a very cutting edge technology in IVF these days to identify genetically abnormal embryos. Three types of PGT: one is PGT-A, PGT-M, second, and third is PGT-SR. So, I'll tell you briefly a little bit about them, what that means. So, PGT-A means genetic testing of aneuploid embryos. So this test is basically used to detect, usually see in our body, every cell has 23 pairs of chromosomes. One we get from our mother, one pair from our father. There is increased age of the mother, there is increased chances of genetic abnormalities. There may be extra pair of chromosomes. So instead of 46, we might have 47 chromosomes. Maybe sometimes there may be missing chromosome, it might be 45, which is called Turner syndrome. So this PGTA, that is aneuploidy testing, basically checks the number of chromosomes in the cell. If it is more or less, there is deletion or addition. So this is usually we have noticed then when there is extra number of chromosomes in the cells, there's increased chances of abortion, increased chances of implantation failure after IVF, and also increased chances of having mentally abnormal baby. That is a baby with Down syndromes. 21st pair of chromosome has one extra chromosome. Okay. So now next is PGTM. So this is for monogenic disorders. So this test is usually done to find out if there is any abnormality in gene. So gene is, now I told you about chromosomes. So gene is basically a small part of the chromosome. So we have to find out if there is any problem. So this is usually done in case of people who already are carriers of some genetic disease, or who are suffering from known diseases like cystic fibrosis, Marfan's disease, sickle cell, hemophilia. So what we are doing is we are going to test the embryos, and we are going to discard the embryos which are having these genetic abnormalities, and only going to transfer the healthy embryos. So in this way, though even if you are having that disease, your baby will not have it. So now the third type, that is PGT-SR, that is PGT with structural rearrangement. So this is again detects chromosome anomaly. Sometimes there may be some structural rearrangements in the chromosome like translocation or inversion. So this can be detected by this test. So now one important, so how is PGTA done, PGT done? So I'll tell you more about it. So for that, it's important that the patient has to undergo IVF cycle. So IVF will be done, embryos will be formed. Embryos are also of two times usually, day 3 embryos and day 5 embryo. The day 5 embryo is called the blast. So PGT is done on a blast, that is a day 5 embryo. So what we usually do is we take a small part of cell from the blast, and that is sent for testing, for all this chromosomal testing. Once the test is sent, it takes some around, depends on lab to lab. Usually we get the report in a week or 2 weeks time. So till that time, this embryo will be again refrozen, and once we get to know which embryo is normal, that embryo will be transferred subsequently in the next cycle. So now eligibility. Now who are these patients for whom we should offer PGT? So this is a very complex thing. Because see, we have to take this decision priorly before IVF. You can't start an IVF cycle and suddenly take this decision. So who are the patients are eligible are patients who have had recurrent pregnancy loss, because we have there are studies which have shown that repeated genetic abnormalities can cause abortion. So recurrent abortions, and then patients who have undergone multiple cycles of IVF and there is failure, and then also when there is known genetic disease in the parents like sickle cell or thalassemia or hemophilia or Fragile X syndrome. There are many disorders. Okay, and then fourth is when there is advanced age of mother. So because as the age of the mother increases, as it's more than 35 or more than 40 years, the risk of genetic abnormalities in the egg is more. So it can be used in that case also. So this decision has to be taken after consulting the genetist, the embryologist, and the IVF specialist or clinician. Benefit is that we are going to transfer a very good quality, genetically normal embryo. So this will of course increase your chances of success in IVF, and also you'll have a healthy, there are increased chances of having a healthy baby. So does BGTA mean that you'll again have 100% success? No, that's not possible. Because for a successful pregnancy to happen, there are a lot of things which are important. Not only the embryo quality, the endometrium should be good. There should not be other problems with the uterus like fibroid, adenomyosis. And there should not be some blood disorders like anti-phospholipid antibody syndrome, because if that is there, then they'll, even if the transferring a good quality embryo, still you may have recurrent abortions. So PGTA does not mean that 100% success will be there. Now, what is the problems with PGTA? Why we are worried? What are the side effects or complications? So see, one thing is that it is an expensive process. It's because we have to send each embryo for testing. And another thing is that you might have to undergo multiple cycles of IVF. Because if someone is having less egg reserve and they get less number of embryos, so again we might have to go for multiple cycles. More number of blasts is required. A day 5 embryo is required. Sometimes what happens, the embryo doesn't grow beyond a day 3. And also, since we are taking a small amount of cells from the blast and sending it, there is also some risk of injury to the embryo. And also sometimes the test is 1 to 2% cases the sample may be inadequate which we have sent, or the test can come as inconclusive. And also you can't do a fresh embryo transfer in this case, because we have to freeze the embryos and wait for the result to come back. And there's also this one dilemma. See, there is some embryos which are called as mosaic embryos. That is, those embryos will have cells with normal number of chromosomes, as well as few cells which will have this abnormal chromosomes. So then it becomes a clinical dilemma whether to transfer these embryos or not, because studies have shown that in few cases when a mosaic embryo is transferred, there's increased chances of implantation failure, increased chances of abortion. But there are also a lot of cases where these mosaic embryos have been transferred into the uterus and healthy babies have been delivered. So then this becomes a clinician's and patient's dilemma. I think I've given you a small gist about what is PGTA and how is it done and why is it done. In case if you have any further doubts, you can reach our website or call us and come and visit us in the clinic directly.